every day and in every way. Enjoy that I fight support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darabite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darabite from LB Pharma. Darabite, love yourself.
An exclusion is a provision within an insurance policy that eliminates coverage for certain acts, property types of damage or locations. Things that are excluded are not covered by the plan, and excluded costs don't count towards the plan's total out-of-pocket maximum. In a nutshell, an exclusion is a condition or instance that is not covered by your insurance plan. Just as each plan has a list of items that the insurance company will cover, they also have a list of items they will not cover. While there could be several reasons why a specific condition or doctor visit is not covered, it's important to review and actually understand the exclusions of an insurance plan before purchase. Policy exclusions create a balance between coverage for fortuitous losses, losses that you couldn't have reasonably prepared for, and the need to remain solvent in order to pay those claims. Our topic today is exclusions in health insurance. We'll be back after this short break. Stay tuned. It's another day with the physicians where your health is our business. My name is Dr. Martina Agbere, your regular anchor on this program. Today we'll be discussing exclusions in health insurance. In the studio with me is a professional. He's a medical doctor. When you see him talk about insurance, health insurance, you want to leave your medical practice and follow health insurance. He's no other person than the MD, CEO of ROTHAUGE Healthcare Limited. He is Dr. Uran-York. Doctor, you are welcome to our program.
Thank you very much, Dr. Martina.
It's nice to see you again here.
Thank you very much.
Now I want to talk about exclusion in health insurance. You know, the last time you were on the program, we talked a whole lot about the importance of health insurance, why people should, the different packages that you have, and the ones that people can actually key in. And I recall in the course of that program, we talked about some ill health, some diseases, some areas that are not covered by insurance. And you promised that you will come back on this program to talk more about the exclusions in health insurance. And we're glad to have you here today. So let's start.
Thank you very much.
When you talk about exclusion in health insurance, what does exclusion mean in health insurance?
Thank you very much, Dr. Martina Agbere. Well, when we talk about exclusion in health insurance, we mean those aspects of medical care that health insurance will not cover. We largely refer to them as exclusions, while those aspects of medical care that health insurance will cover are the ones we call inclusions in health insurance. And as you would agree with me, if health insurance covers everything, then the health insurance fund will be bankrupt. So there are certain illnesses that health insurance will not cover. And I'm sure in the course of the discussion,
you will tell us the reasons why some will be covered, why others will not be covered. So what is the difference between sublimits and exclusions in health insurance? We always hear it, there's this sublimit. So what is the difference? They want to know.
Now, what we mean by sublimits in health insurance refers to the scope of medical coverage. Take, for instance, if we take on procedures like surgeries and the different grades of health insurance plan, normally there will be a limit or ceiling. So for this particular plan, we could say your limit is 450 for surgery. Your other plan may have, say, 650 and all that. And then we could say physiotherapy. For this particular plan, we could have 10 sessions, 15 sessions. It doesn't necessarily mean that that problem will be solved by 10 sessions or 15 sessions. It simply means that that is the limit of the coverage of such.
And after that, what happens?
After that one, the
person will pay from out of pocket?
The person will pay out of pocket, because that is what the person has purchased. And as you rightly said, before you purchase a health insurance plan, you look at yourself and look at what the plan covers, and be sure that the plan you're buying for yourself or your family member actually will take care of up to 75–85% of the commonly occurring illnesses, that is prevalent in your own family. Then the ones we call outright exclusions are the ones health insurance does not cover at all. They don't cover at all. They don't cover the exclusions at all. They don't. Health insurance, there are some.
Okay, so before we continue, if somebody wants to get a health insurance policy, what are the things the person is supposed to look out for?
Yeah.
What should the person look out for to say, okay, this is a plan I want to take, this is a plan I want? So what should the person look out for?
Now, for somebody purchasing health insurance, if you're purchasing the individual plan, then you look at yourself and your medical condition, because you know the conditions that you have. If you're buying a health insurance for your family, you have to look at what the family will need. That will guide you as to the type of health insurance plan that you purchase. A young family, your spouse, if the principal is the man is the principal and the spouse is having children, you have to look at the plan that copiously covers obstetrics, and gynecology.
Okay.
So you have to really study the plan, so that you don't pick a plan that most of what the plan excludes, or most of the limit of the plan are the things that your family needs. Okay. So that's the major thing that determines the type of health insurance plan that you pick.
Okay. So what are the general exclusions in a health policy, in a health insurance policy? The general exclusions that is a no-no.
Now, there are so many general exclusions in health insurance policy. But if you look at them too, these are the things that people don't need for most of the time.
Okay.
And these are the things that if the health insurance carrier or the health insurance underwriter attempts to cover them, that health insurance fund, or otherwise called the sickness fund, will be bankrupt. Take, for instance, number one, a general exclusion is emergency medical evacuation aboard air ambulance. And then number two, cosmetic surgeries. I mean, body contour surgeries, the ones they call breast enlargement or both job, health insurance don't cover those things.
Okay, cosmetic surgery.
Yeah, cosmetic surgery.
If the cosmetic is as a result of, for instance, a burn, it will be covered, right?
Yeah. That brings in what we call functional cosmetic surgeries and cosmetic surgeries that are for that beauty, as in cosmetics. So the functional ones, health insurance cover. Again, if an illness is as a result of industrial accident, those ones are covered by life insurance policy or the general insurance policy under the act we call the Workmen Compensation Act. And then injuries from extreme sports, like if you go to do mountain climbing, horse riding, motor racing, motorcycle racing, and you have injury. Health insurance wouldn't
okay, but an individual can actually have a policy to cover that.
Yeah, that will bring us to what we call, buyback.
Okay, we'll talk about buyback.
We'll talk about buyback. Okay. So these are generally what they have, like domiciliary care. If you are ill and you want your health insurance company to send physicians to come and treat you in the house, health insurance don't cover domiciliary care. You have to take yourself to the healthcare provider, like hospice care, There are some certain care for the terminally ill that health insurance don't cover. Like as I said before, we can always bring this back. And then other things too that health insurance don't cover is self-inflicted injuries. If we know that this is a domestic, accident, or this is an injury that is as a result of intoxication or your own activity, so to say, you caused it, health insurance will cover it, unless the health insurance carrier does not know, but if they know. So these are some of the general exclusions that health insurance will want to cover.
Okay. You've talked about the general exclusions that health insurance will cover. The ones that they cover normally, right? It gets to an extent and you say, no, we can't continue with this.
Yes.
So why would you not do that?
Take for instance.
Because it's not the person's fault. For instance, the patient goes for surgery,
yes,
has a fibroid surgery. At the end of the day, you're telling the patient it's too expensive. You can't do this. We can't cover it. This is the amount we can use to cover it for you, and the patient should bring money to subsidize. I believe that what if the patient has paid for this particular policy and is included, everything says this is it. You can cover to this extent. So why are you not doing it? And the patient begins. So what is the profit there for the patient?
Now, if, for instance, surgery, there are limits to surgery. And, for most health insurance organizations, the limit they will put on a surgery is the limit that will take care of that surgery. At times we have people confront health insurance organizations with their lifestyle. Take, for instance, you talked about fibroid surgery. We've had situations where some of the ladies said, I want to have my surgery for fibroid done in a particular hospital, say on Victoria Island, Ikoyi, Lekki, Ikeja or something. I mean, and because of the brick and mortar, the prices of medical care in these places are quite high. But there are some other places that we can actually refer you to, that the surgery will be done by the same gynecologist at a cheaper price, maybe because of the cost of labor or the cost of brick and mortar there. I mean, health insurance practitioners all know these. Take, for instance, in Yaba, in Surulere, in Aja area, this same, we have a paucity of healthcare specialists. These same patients who are the people that will go to all these places.
At this point, I think you are trying to maximize profits. You are not even considering that of the patient. Because if the patient is choosing a policy, of course, you have a list of the hospitals. The only is on me to pick the hospital I want as my provider, right?
Yes.
I'll pick the hospital I want. And now I need the service rendered. At the time of picking that hospital, I didn't know that I was going to have that health challenge, right? Okay, now the health challenge has popped up. I said, okay, this is my hospital. This is where I've been taking my care. This is the doctor that has been treating me. And this medical condition needs to be taken care of. And you come as a provider and tell me, I'm sorry, because the hospital is located here, it's so expensive, I'll take you to another hospital. It's a no-no now, Doctor.
Do not forget that you mentioned something that we need to educate, our viewers,
yes,
our listening audience about. You mentioned something as out-of-pocket maximum.
Yes.
Out-of-pocket maximum actually refers to that maximum amount that your health insurance carrier can pay. So your health insurance carrier can pay for that out-of-pocket maximum. Once your health insurance carrier pays for that out-of-pocket maximum, the remaining medical bill, you will pick it. So that is how it works. So that more persons can be served. So that more persons can benefit from the health insurance from. So from the beginning of the policy, these things are made clear.
Okay. Doctor, I'm laughing because when it comes to this kind of cases, the provider is always there to ensure that the patient does not cross this particular limit. But how about those patients you have paid for a policy, you are not even using it? For instance, it's a pool. You are not even using it. So why won't you it's not in all cases. This patient can't even afford it. So why won't you just, okay, let's let it go?
You are now talking about another thing that we again need to educate the people that are listening to us or watching this conversation. Like health insurance is a pool. Yes. Don't forget that the more persons that contribute, yes, the deeper the pocket will be. Yeah. Now, if one person does not use, it does not mean that others will not use. Do not forget that if so many persons use, the fund will be bankrupt. Look at some of the money a family will pay as health insurance premium for a full year. One person's surgery, as common as a cesarean section, one lady's cesarean section, that particular family, the premium might not even cover it. So it is a question of if half of the people that contribute to the pool get to utilize medical service. Of course, the health insurance.
So I needed to drive home that point.
So we have to keep these caps.
Yes.
Do not forget that almost all the specialists and almost all the doctors that, the health insurance companies, work with are certified, board certified.
Now, what is the difference between an individual market and a group market in health insurance?
Yeah, thank you very much. Now, when we talk about the individual market, most of us in Nigeria know it as the private health insurance market. The group market is known by most of us as the employer-sponsored health insurance market.
Okay.
If I'm a company that have 100 staff and I want to enroll my 100 staff, it's different from when only one individual is coming on board.
Okay.
So that one individual is one we call the individual market. Now, what we, the health insurance underwriters, have come to see for most of the time is that in the individual market, it is the people that are already sick that wants to join. So these people, for most of the time, are already coming with what we call pre-existing illness.
Baggage.
It could be hypertension, it could be diabetes, it could be lupus, it could be acne, it could be maybe the person is a sickle cell disease, And again, it could be pregnancy. Don't be surprised that in health insurance, we call, if you're pregnant and you're coming on board our health insurance as a single individual, we call that a pre-existing illness, when actually it's not an illness. Because we've actually seen when immediately a woman misses her period, she wants to come on health insurance plan. And immediately she has that baby on the health insurance plan, it won't pay for the next year. Therefore, in the health insurance, in the individual health insurance market now, we do what we call medical underwriting. We look at your prior 1 year medical history. And if you are a hypertensive person, you're diabetic, or you're pregnant, we could say that your health insurance premium will be higher. Or we will give you 2 years or 3 years or 1 year waiting period so that you pay premium for at least 2 or 3 years before that particular illness is covered.
Okay.
This is our typical practice in Nigeria.
But what is the standard?
The standard has always been like this in America up until 2014, when the Affordable Care Act came up, I mean, the Affordable Care Act, people know it generally as the Obamacare. It is one act that forbids the health insurance organization from discriminating against who has a pre-existing illness.
Yes.
And it's
I hope it will kick in here very soon.
Well, we are not there. We're far from there. We're very, very far from there. We hope that, with the National Health Insurance Scheme becoming National Health Insurance Act, and I mean, they just launched a new guideline on the 20th of October, I mean, which is voluminous, and, even we, the players, are still looking through it, And, quite recently there was a conference last week where the Health and Managed Care Section tried to x-ray some certain things that will have to go back to the National Health Insurance Act, to discuss with them, because that discrimination is here now. Now, this is the individual market. Now, when we talk about the group market, these things are not there. Because if you have 100 persons or say 1,000 persons, I didn't think about it. How many persons can be pregnant there at a single time? I mean, if we say it's a young population and that 10% of the population will be pregnant, then the health insurance premium will be enough to cover the pregnancy. And by the way, don't forget that, in the coverage of maternity, antenatal care, delivery, be it normal or cesarean section, because as we doctors, we know that a normal delivery now, you, the doctor, you'll be thinking that, this woman would deliver normally. And the next time is the operative delivery. Everything has to be covered. So the restrictions, that is in the individual market is not in the group market because of the sheer number of people and normally to the payment pattern. You will understand that it will be easier for a company to pay for health insurance, package, be it quarterly, 6 monthly or annually, than a private individual. And again, when it comes to chasing a policy holder, for premium or payment, it's easier for you to chase an organization than for you to chase a private individual. So, so this is the real difference between the individual market and the group market.
Okay, so as an expert, I know you are already on the grassroots, you do a lot of this. As an expert here, what do you see in Nigeria? Are the companies really keen in? Is there anything that can make them ensure that this is done? Are they cooperating?
Well,
not the big companies. Like, okay, for instance, how many people would you say in should be in a company before you can say, okay, classify them as group? And are they keen in?
From the National Health Insurance Act, when a company has up to 10 persons and above, they qualify to, enroll. But we are yet to see that, regulatory drive, regulatory bite, Pension used to be something close to optional up until legislation came and made it compulsory. As we speak today, as of last year, it's been made compulsory, but we are not seeing that massive uptick. So ours is for the National Health Insurance Authority to come out with some set of regulations, some set of sanctions for organizations that are yet to key in. Now, this is what the National Health Insurance Authority, says about group plan. But from experience, the individual health insurance carriers or HMOs still have some numbers because regulation is not that, it doesn't that bite.
Okay. Yeah, before I allow you go, what is a buyback that you talked about?
Buyback simply means there are some policies that some health insurance organization write that excludes dental, excludes optical, even when the basic from the National Health Insurance Authority includes them. Or some organization will come to and say, this is our budget.
Okay.
We cannot pay more than this.
I was just going to ask that.
You remove data, remove optical.
Yeah.
And, and you remove it. And some individual from there will say, no, we need it.
We need this, yeah.
And they will now begin to do what we call individual underwriting again.
Okay, so
this is generally what they call buyback, So you are trying to buy what is excluded normally.
Okay. Well, time is not always our friend. Before we let you go, just final words to our viewers. Final word.
Well, any person that carries on in this society as if illness is not his or her passion, I think you should have everything. Illness strikes when nobody is really ready. Take, for instance, I have been a doctor, and I've been practicing, health insurance. I've been a doctor for some very long time. Now, if there is an acute illness, either for me or a family member or a loved one, that cash might not be there.
Sure.
Or because I have health insurance policy, or maybe because I have, friends of my family members, most of them that are close to me, I've made them to buy health insurance policy. They will just take themselves to the hospitals and they'll be managed. Okay. So, everybody should try and hold a HMO card, which is that health card. It is very, very important. Thank you so much.
Everyone should hold an HMO card, a health card,
important.
which is very, very important. Thank you very much, Dr. Nte. It's been nice having you as our guest. always like a lone voice in the wilderness talking about insurance. We have been schooled today about exclusions in healthcare. I really appreciate you. Thank you so much for coming. And to our viewers, I just want to say thank you again for being part of our program today. You've heard about health exclusions in health insurance. Do you have a health card, the HMO card? Please, if you don't, today, sit down and discuss with your family. Sit down and discuss the one that you will benefit from. Don't go without having a health insurance. Don't always think the insurance are there, the insurance companies are there just to make funds. Because, of course, you have a very valid fear, the ones that happen that has to do with cars. But this is your life. It has to do with health. Please get an insurance policy to cater for you, to cater for the loved ones. My name remains Dr. Martina Agberie. Remember to follow us on all our social media platforms. If you want to be part of this program like Dr. Nte, please go to our website. It's just a click away. Complete the form and you'll be our guests. Stay blessed. See you next week.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.